Orencia Abatacept is used alone or in combination with other medications to reduce the pain, swelling, difficulty with daily activities, and joint damage caused by rheumatoid arthritis, a condition in which the body attacks its own joints, causing pain, swelling, and loss of function in adults who have not been helped by other medications. Abatacept is also used alone or in combination with other medications to treat psoriatic arthritis, condition that causes joint pain and swelling and scales on the skin in adults. How should this medicine be used? Abatacept comes as a powder to be mixed with sterile water, to be given intravenously into a vein, and a solution, liquid, in a prefilled syringe or an auto-injector to be given subcutaneously under the skin. It is usually given by a doctor or nurse in a doctor's office or healthcare facility when given intravenously. It also may be given subcutaneously by a doctor or nurse, or you or a caregiver may be told to inject the medication subcutaneously at home. When abatacept is given intravenously to treat rheumatoid arthritis or psoriatic arthritis, it is usually given every 2 weeks for the first 3 doses, and then every 4 weeks for as long as treatment continues. When abatacept is given intravenously to treat polyarticular juvenile idiopathic arthritis in children 6 years and older, it is usually given every 2 weeks for the first 2 doses, and then every 4 weeks for as long as treatment continues. It will take about 30 minutes for you to receive your entire dose of abatacept intravenously. When abatacept is given subcutaneously to treat rheumatoid arthritis or psoriatic arthritis in adults and polyarticular juvenile idiopathic arthritis in children 2 years and older, it is usually given once weekly. You may inject abatacept injection anywhere on your stomach or thighs except your navel, belly button, and the area 2 inches around it. If someone else will be injecting the medication for you, that person can also inject it into the outer area on your upper arm. Use a different spot for each injection. Do not inject abatacept injection into a spot that is tender, bruised, red, or hard. Also, do not inject into areas with scars or stretch marks. What you need to know before you use Orencia. Do not use Orencia if you are allergic to abatacept or any of the other ingredients of this medicine. If you have a severe or uncontrolled infection, do not start treatment with Orencia. Having an infection could put you at risk of serious side effects from Orencia. What side effects can this medication cause? Abatacept may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Headache, runny nose, sore throat, nausea, dizziness, heartburn, back pain, arm or leg pain.